All right, so welcome everybody to our Lunch and Learn today on immunisation catch-ups. Let's see if this is good. I would like to start by acknowledging the traditional custodians and sovereign people of the land across which we work. I recognise their continuing connection to land, water and community and pay respect to elders past, present and emerging. Sovereignty has never been ceded, it always was and always will be Aboriginal land. I also extend that respect to any Aboriginal colleagues who may be joining us today. Today, we are joined by Anne Allen, and she's the Immunisation Coordinator at Southeastern Sydney LHD Public Health Unit. Thank you for joining us today, Anne. Just a little bit of housekeeping. Let's get rid of that. So today we're going to use the chat function. Whoops. Back. The chat function to ask questions. This is a limited session and with the objective of being more interactive type session. So please use the chat box throughout to answer questions. And, you know, if it's a more, it's an easier question to ask on microphone, then please feel free to put your hand up and speak on microphone to ask your questions. Please note this webinar will be recorded and there will be a participant evaluation survey link that will pop up on your screens at the end of the webinar. We appreciate your feedback, so please complete to allow us to improve our program. And lastly, we will be doing some case studies at the end of this session. So I hope you've all got copies of your catch-up worksheets ready to fill out, whether it be with a pen and paper or on your computer. And there are 4 of these. We'll probably only get through one or two of them today, so there will be some homework. And Anne has kindly offered to run a follow-up session for all students on Tuesday, the 21st of March at 12:30 to just go through the case studies and check your catch-ups are correct and answer any follow-up questions as well. So after today's session, you'll be sent an email with a link to register for that session if you'd wish to attend. All right. They're just a couple of our upcoming events. If you'd like to register, you can always register online on our events page. All right, time for my introduction to Anne. Today, joining us is Anne. She's been a registered nurse for over 40 years, working in a variety of settings, and a midwife for over 20 years, as well as a child and family health nurse for over 15 years. She started work in the public health unit in 2007 after completing the accredited nurse immuniser course, and then completed her master's in public health in 2015 when she gained the immunisation coordinator position. She has a passion for immunisation and finds her work in immunisation fulfilling and varied. It's always interesting and very often challenging, always busy and never boring, which I'm sure a lot of you can comment to. First up, we just have a couple of questions that we're going to poll everybody on to just kind of get a feel for where everybody's at in this group. So Christine, if you'd like to put up the first poll for me, please. How many immunisation catch-up schedules have you worked out before? All right, so got 11, 13, 14 people. So we've got about 25 in the room. So I'll give it another 30 seconds to complete. But it looks like most of you have done a few, but not too many. Excellent. Great to know. Yeah, all right, we'll leave it there. And then the next question, how long does it usually take you to work out a catch-up schedule? Yep, so as we can see from there, they can be quite time consuming. But hopefully with the training that you'll receive today, you'll know the right resources to go to, and hopefully some of them at least can be a bit quicker. There are always going to be those ones that take an hour or so. Excellent. Well, that's great to know. Thank you for sharing that insight with us. So Anne, I'm going to pass over to you to start sharing your screen.
Is that right?
Yep, and then if you just put into presentation.
Oh, yeah. Okay.
Perfect.
Okay. Hi, everyone. Thank you for the invitation from the Primary Health Networks to come and help people with the catch-up vaccinations. This presentation was developed by myself and Caitlin Swift, who is a public health medicine registrar at the Public Health Unit. Unfortunately, she has left now and she's moved on to the NCIRS. But yeah, last year we both did this, and yeah, this is what we've come up with. I also wanted to acknowledge do the acknowledgement of country. So I acknowledge that I'm hosting this webinar from the lands of the traditional custodians of the Dharawal, Gadigal, Wangaroo, Guigal and Bidjigal people. I also acknowledge the traditional custodians of the various lands on which you all work today and the Aboriginal and Torres Strait Islander people participating in this webinar. I pay my respects to elders past, present and those of the future and celebrate the diversity of Aboriginal people and their ongoing cultures and connection to the land and water of New South Wales. And that beautiful piece of art was created by Brendan Broadbent, who is from the Dharawal Nation, and it depicts the Aboriginal lands that we work on, which is part of the SESLHD Southeastern Sydney Local Health District area, which we're all from, I think, all working. Okay, so we're going to do a bit of, this is just an overview of what we're going to be doing. Principles of catch-up, funding, lab testing, the catch-up calculator, developing a catch-up schedule, and the resources available to assist. And then we've got 2 children and 2 adult case studies. And we're going to ask you to pick which ones that we're going to try and do today. I'll get one done, but I don't know if I'll get more than that done. Just depends on how difficult it is. Okay, so just some principles of the catch-up vaccination. So you aim to complete the person's recommended vaccination schedule in the shortest but most effective time frame. So in that, it's best not to split vaccines. It's not a good idea, and we need to get the optimal protection against diseases as quick as possible. Assess vaccination status based on the NIP schedule and state and territory the person lives in. If previous vaccinations cannot be confirmed in writing, assume they were not refused. So if you don't have the official catch up of what they've had previously, or not catch up, what records they've had previously, then you vaccinate as if they've not had any vaccines. In almost all cases, count documented previous doses as part of the schedule and don't start the schedule again, regardless of the time since the last dose. This is except for oral cholera vaccine that cannot be counted if given more than 6 weeks ago. The interval between doses in a catch-up schedule may be shorter or longer than the standard interval, and the number of doses may need to decrease with age. For some vaccines, catch-up vaccination is not recommended. For example, the rotavirus vaccine, if it can't be given on time, it is not given. That's also the same for their birth hepatitis B. If that's not given within 7 days of birth, it is not caught up. Do not defer due and overdue vaccinations. If more than one vaccine is overdue, give 1 dose of each due or overdue vaccine at the first catch-up visit. Schedule further required doses after the appropriate minimum interval. Healthy individuals can generally receive inactivated vaccines at any time before or after, or at the same time as all other vaccines registered in Australia. Multiple live parental vaccines can be given either at the same time or at least 4 weeks apart. So that's the live virus vaccines. Some people need further doses of antigens that are only available in combination vaccines. In general, it is accepted to use combination vaccines, even if this means the number of doses of other antigens exceeds the number required. And we'll see that when we're doing the catch-up. Once up to date, you follow the NIP schedule for the age that they are. Okay, so funding for catch-up vaccinations. There's all sorts of places that you can find this. So hang on, I'm just going to, I've saved these. So New South Wales Health has now got, hang on. This additional Commonwealth and New South Wales funded free vaccinations. So this has just recently changed due to the HPV vaccinations. I'm presuming you've all heard that HPV course is only 1 dose now and it goes up to 25 years. And that's free for those people up to 25 years. This is people with Medicare numbers, any international students, this does not include. They can have it, but they need to pay for it, and they'll have to claim it on their private health insurance. So if you want to find out where this is, it's in New South Wales Health, additional Commonwealth and New South Wales funded free vaccines, and it goes down through hepatitis B, MMR, and rabies. Oh, sorry, hang on. And then there is HPV. So this is the free catch-up for refugees and humanitarian. This is the NIP schedule for them. So it's free for over 20 years for refugees and humanitarian. They get these for free. And I think that's all I've got saved up here at the moment. So I've explained this one, the NIP catch-up vaccines are now up to 25 years, and the refugee and humanitarians. New South Wales funded additional, which I've already gone over, the hepatitis B for at-risk priority populations, MMR and rabies post-exposure treatment. Vaccines outside of this must be purchased privately. Consider offering other vaccines recommended but not funded. So there are some funding for some influenza cohorts, but the majority of people would have to buy for it. So you need to include that in your catch-up and just say in your catch-up it is not free for you, but please have it. And the dose 2 varicella, which I'm going to go over later. Okay, so lab testing. It is an option to test for immunity due to vaccination and previous infection, but it is only reliable for hepatitis A, B, measles, mumps, rubella, and varicella. Now, the varicella is not always reliable. So the varicella immunity following vaccination is not detected using current available blood tests. Serological testing before vaccination is generally not recommended for children, but may be helpful in older adolescent and adults with no prior history of varicella infection or documentation of age-appropriate varicella vaccination. For further information on serological testing before and after vaccination, it's in the Australian Immunisation Handbook, which I will go over later. So testing to guide catch-up vaccination is not routinely recommended for other diseases. In most cases, previous infection is not a contraindication to vaccination. So if they've had chickenpox disease, they are still encouraged to have vaccination. This is the exception to this is Q fever. If they've had the disease Q fever, they should not have a vaccine for it. And indeed, you need to check if they've had the disease previously. May be more practical to offer vaccination rather than lab testing. That's just something to remember. Okay, so one way to do a catch-up is the National Immunisation Catch-up Calculator. It's available online and it's currently only for children less than 10 years. You enter previous doses by date and either vaccine or antigen. The foreign language terms, which I've got open here, I'll just show you this. It shows you what vaccines overseas are called. Okay, so in different languages, so you can use this, and the access to this is, I think you've got a list of resources, so it's in there. So it can be very helpful. You generate a complete catch-up schedule, check for accuracy. So the calculator is fabulous and they're getting better at it, but it can spit out incorrect information sometimes. So if you're not sure on how to check it, you can send it to me and I'll check it. I'd rather you have it checked than not check it at all and give the wrong vaccines. Okay, so the Australian government offers a free translating service for health documents in other languages, and that's the website there. I'm not going to go into how you use the catch-up calculator. It's pretty self-explanatory. Where is it? I've got it open here. Oh, I don't. It's in the, you just Google it and you've got the link to it anyhow. Sorry. Okay, so developing a catch-up. This is generally what you need to do to develop your own catch-up. You confirm the name, date of birth and current age, their Medicare number and state or territory of residence. You confirm the vaccination history, so you determine the number of doses and the dates of vaccine already given. Confirm validity of the previous doses according to minimum acceptable ages of dosing intervals. So they may have had all the 3 doses of hepatitis B overseas, but they may not have been at the optimal spacing, in which case they may need a catch-up for that. Check how many doses are required for the current age. Consider eligibility for additional vaccines, so that is Aboriginal or Torres Strait Islander, immunocompromised, underlying medical conditions predisposing to invasive pneumococcal or invasive meningococcal, or preterm birth that's less than 32 weeks gestation. And then you create a catch-up schedule using the resources that we've got listed here for you. And you refer to the New South Wales immunisation funded vaccinations to see if they're free or not. And this is a catch-up worksheet for less than 10 years of age, but you can use it for any age. A lot of these here are not used for adults, but you can still use it. You don't have to use this. This is just a guide and it helps you to remember what you need to look at. And I think you've got some of these in the resources. So I will be using one of these. Yeah, and these are all the resources. They are from the Australian Immunisation Handbook, and they're excellent. So these are just my tips for a catch-up. This is just what I've learnt over time. You write all the information down. So you write their date of birth and their age now, what previous vaccines they've had, the dates and the ages. Always check on air before you do a catch-up. They must, if they're on air, you must check it. And any at-risk conditions, what they need for those. Use the worksheet until you are confident and know what you're doing. Consider serology. Always check advice in the Australian Immunisation Handbook, either in catch-up section or in the individual diseases section, and other resources in this presentation. If less than 5 years, always check the Hib and the pneumococcal catch-up tables in the Australian Immunisation Handbook first, because that will guide you on how many vaccines this child is going to need. Get your catch-up schedule checked until you are confident. Practice RNs should do the accredited nurse immuniser course, and there's several courses, and the PHN have scholarships available if you are interested in it. And remember to include free influenza or influenza, even if it's not free, and strongly encourage influenza for those who are not eligible, and dose 2 varicella for less than 14 years. It's not funded, but it is a recommendation. Yeah. Okay, so we've got 4 case studies. The Aboriginal boy who had 6-week and 6-month vaccine, he's 18 months now, and his parents now want him to get up to date. Their 6-year-old girl born in the Pacific Islands had all her vaccinations there, but mum does not have any records and can't get them. There's a 32-year-old female who's starting as a healthcare worker in New South Wales public hospitals. She can't find any records of her previous vaccinations except for the 3 doses of COVID. And a 25-year-old male recently became asplenic due to a car accident and has not had any vaccines since surgery.
Thanks, Anne. I've just launched the poll. So just put in your preference for which one we should start with. And while people are doing that, there's just a few questions in the chat, Anne. So first question is, how many vaccines can be given at any one time?
As it says, you need to give 1 dose of every vaccine at the first visit. So I usually try to keep it at 4 weeks, but you're encouraged to give all that is required on the first visit. So you've got 2 arms and 2 legs, basically.
Yeah, and say, for example, you had 7 vaccines to give. Would you give 4 in one arm and 3 in the other?
Talk to the person, talk to the child's parent, and work out what they want to do. I mean, I don't want to say it's okay to split them, but if the parent is adamant they don't want that many, you need to make sure they will come back for the vaccines.
Yep. Yeah, I know it can be hard, but I guess, at the end of the day, it is a joint decision, but you just got to be encouraging that, this is the best outcome for them to have all of these vaccines in their first visit.
Yeah.
And get a second nurse or GP in to help you do the same.
That's right. I mean, the more you get the child back, the more they're going to be distressed anyhow.
Yeah, exactly. Yep. Over and done with in as little visits as possible. So let's just start at the top, Anne.
Oh, yep. Okay. All right. So case 1. Okay. So I'm going to bring over. Where is it? I've lost it. Oh, no. Nope. Sorry, I just have to find my here. There we are. And okay, so how do I, sorry, Kira, how do I make this?
Yep, so Windows and the left key.
Oh, that's right.
I'll just click on the Word document. Yep. Click in there now, Windows and left.
Okay, all right.
Perfect.
Okay, so the first one, I've done that. So this little one was born on the 27th of the 8th. 27th of the 8th, 2021. Okay. And his name is John Smith. Okay. And today's date is the 27th of the 2nd, 23. So age at assessment, that should be 18 months. Is that right?
Yep.
Yep. Okay. So can anyone tell me, he hasn't had, so he's had some previous doses. Okay. So he's had a 6-week dose. So he's had a 6-week dose of the DTP, and he's had a 6-month dose of the DTP. Okay, so he's had 2 doses. So number of doses needed at current age. So he's 18 months. Can anyone tell me how many doses he needs now? So in here, we go to catch up. There we go. And we go to here, catch up guidelines for individual vaccinations in children aged under 10. So in order to be able to go back in the immunisation handbook, you have to right click on this and open a new link. Don't just click on it because you won't be able to go back. And it'll take you down to it. Okay, so this is catch up guidelines for under 10. And then you come down here to DTP and the recommended doses. So the recommended doses are 3 doses of the primary course and 2 booster doses. Okay, so that's 5 that they're recommended. However, if the child receives dose 4 of DTP after 3.5 years of age, they do not need a 5th dose. So you need to remember that. Okay, so at his age, at 18 months, he needs, oh, that's right, I need to bring over the schedule. So the schedule is at 6-week DTP Infinrix Hexa, 4 months DTP Infinrix Hexa, and 6 months DTP Infinrix Hexa, and then at 18 months, a Infinrix or Tripacel. So he actually needs 4 doses. So he needs 4, and he's now up to dose 3. Okay, so he needs a DTP. Further doses, he will need another 1. So is everyone with me? Yep, okay. So this is Infinrix dose 3 is Infinrix Hexa. But dose 4 won't be because he'll be over. So the age the doses, the minimum intervals for these between 3 and 4 is 6 months, and he will he be over 3.5?
No.
No, he won't. So 3 and 4 is infant Rex hexa. But then we need to also go and look at the Hib. Polio is the same. He's had at 6 weeks, 2, and at 6 months. Once he's had, he needs another 1 dose. So to go down to polio, sorry, I'll do that in order of what it's coming up. This is polio. So if a child receives a 3rd dose over 3.5, give the 4th dose at the 4th birthday. So there needs to, this child will have the 4 doses. So now he needs 1 more dose to take it up to dose 3. So, and then at 4 years. Hepatitis A. Now, Aboriginal children, depending on where they live, Aboriginal children need meningococcal, which this little boy hasn't had. So we'll look at that one in a minute. But also, where's this one? Depending on where they live, they need extra vaccines. So this is for Indigenous people. And in Western Australia, Northern Territory and South Australia, they need extra pneumococcal at different stages. So this is another resource that you will need. But it's not for this child. He lives in New South Wales. So no hepatitis A. They do need extra hepatitis A in other states. Hepatitis B, he will have had this at 6:52 and 6:20. He needs 1 more dose. He needs 3 doses altogether. So he's up to dose 3. And Hib. So this is what I usually do first. This is the Hib catch-up. For all children under 5. So this child has had 2 previous doses, and he's presenting himself, or mum's presenting him 18 years of age. So you go to here, number of previous doses is down this column, and current age. So he's had 2, and his current age is 18 months. He had the 1st dose and the 2nd dose under 12 months of age. So sorry, I'm gonna have to. Sorry. What's this one? It's PCV. Yeah. So he's had 18 months. So you see here, age at 1st dose, age at 2nd dose, age at 13 dose, and then the number of primary doses needed, and then booster doses. So we're here. He doesn't need any more primary doses of Hib, and he needs 1 more booster. Okay. So he's had 6/52 6/12. He needs one more. So, and that will be dose 3. The pneumococcal, I'll just go down and do that one. And that's another table. Is everyone with me? Any questions, or am I confusing people?
Everyone's got some thumbs up still, no chat
Okay.
questions so far. So yeah, good to keep going.
Okay. Okay. Oh, what's this? So this one is for pneumococcal with kids with medical conditions. So it's the one up here for not pneumococcal, Prevnar 13 that do not have conditions. And this child's had 2, now presenting at 18 months. Both doses were given under 12 months. He needs 1 more dose. Okay.
Sorry, Mark, was that a thumbs down? Did you want to ask a question?
So 1 more, wasn't it? That'll be dose 3. Okay, so for this child, has no medical conditions, so doesn't need pneumococcal, but a lot of Aboriginal kids do have medical conditions, in which case you would have to go to the pneumococcal, the Pneumovax 23 section and work out what this child needs for Pneumovax. So doesn't need any of those. Meningococcal ACWY does need 1, hasn't had any, needs 1. MMR, 2 doses. Oh, it hasn't had any doses. Needs 2 doses. Needs 1 dose now, and then second dose 1 month later. Rotavirus, too old. Has had 1 dose, and so that's better than none. Hasn't had any varicella. Needs 1 dose. 1 dose. Encourage second dose 1 month later. Not for free. And down here, influenza needs 2 doses, 1 month apart, and that is because anyone under 9 years of age needs to have 2 doses as part of their initial vaccination. They need to prime their system. 2 doses, 1 month apart. Influenza vaccines are free for Aboriginal children and Aboriginal people. And the varicella, encourage the second one. Encourage second dose, but the parents need to pay for it. And also, which isn't up in the workout, is the Bexero for Aboriginal children. So this child is 18 months, so we need to start him soon on his meningococcal B. So you go up here and go to diseases, open the link, right click, open the link, and then go to meningococcal, right link, open up here, and the recommendations, right click, and it's here. And this tells you how many doses this child will need at his age. From 12 to 23 months, Bexsero, he needs 2 doses 8 weeks apart.
And I guess with that one, it's important to note that that's another one that's recommended for all children, but it's just only free for the Aboriginal children.
Yeah, it's only recommended under 2 years of age, though. 8 weeks apart. Okay. So what questions have you got for this?
Yeah, do we have any questions? I can see Mark's put in the chat box, who do we contact to sort these complex catch-ups out, as given our time constraint just is almost impossible. So yeah, it is, you know, your role as a health practitioner to do the work, and that's why we have these tools available like the catch-up calculator, and for those more complex ones, you know, instilling the help of, you know, if it's in another language, use the TIS translating service. You know, Anne and the public health unit are always happy to check over catch-up schedules once the work's been done, but there isn't a service out there that does this work for you, unfortunately.
I do them. I do help people out. So I prefer you to have a go. The more you do it, the easier you get. I struggled big time with this too, but the more you do it, the easier it does become. Okay, so that's why I've given you the homework as well, to have a go at it, and then we can come back and look at it. You get more confident where to look, what to do. Yes, there are some very complicated ones, and I'm always here to help.
Yeah.
Okay.
Thanks, Anne. And I have put the Sydney Local Health District Public Health Unit email in the chat, but also we'll include it in our follow-up resources as well. Asha has asked, it is too complicated for point of care patient. It is too complicated for point of care. Patient will have to be recalled and may miss getting vaccine at presentation.
Yep, absolutely. And there's nothing you can do about that. This needs to be worked out when you've got a moment or two.
Definitely. Something that can be rushed.
Yeah, a complicated one like this, they need to be able to come back. But I mean, just by seeing that this child has had the 2 Infinrix hexes, you can see that they need the MMR, the Boostrix, not the Boostrix, the MMR, the Bexsero, the meningococcal ACWY, and you know, and then you can work out the other things later. You can just see from this that what they need straight away.
Yeah. Teresa asks, why is meningococcal B recommended to all people that is under 2? Is it a risk in Australia or in some regions?
Yeah, so there is meningococcal around and it is a risk. They do provide the free ACWY, but they don't recommend that. They don't provide the B for free because it's a value of money. That then the amount of kids that end up with meningococcal B is pretty small compared to the amount of money it would cost to put that program on the NIP. But in saying that, these are your children, and you know, or their children, and if they've got the money, then a lot of people are willing to pay for it.
Yeah. So yeah, it is important to note that just because vaccines aren't on the schedule doesn't mean they're not recommended. And we have included in our resource sheet the NCIRS recommended table of vaccinations, and that shows which ones are free and which ones should be paid for. And yeah, at the end of the day, it's just a cost-benefit analysis. We're lucky we live in a country that, you know, most of these vaccines are provided for free, but they just can't provide every single vaccine that we need to be vaccinated against for free. And yeah, as Anne said, the cost benefit analysis isn't there for MenB, but it is still a risk, and that's why.
Except for the Aboriginal kids.
Yeah.
The Aboriginal people are affected by meningococcal B far more than what other people are.
Yeah, and again, also in South Australia, I know that the South Australian government fund it for their kids because it's more prominent in South Australia. So yeah, it is out there, yeah. And another question, I record all the past immunisations into a patient's AIR record, and then it will come back with all overdue vaccinations. How reliable is this method?
Okay, so AIR is not a clinical thing, so you shouldn't actually take what AIR is saying as gospel at what they need. They generally get it right, but they can get things wrong. So you should not use AIR and what they say is overdue as a catch-up. You shouldn't.
Yeah, so yeah, for the AIR record that comes back is just calculated by, you know, the computers and with the parameters that they have put in. And, you know, it's a good starting point, but definitely should follow up with using the catch-up calculator or working one out by yourself. And especially as well, AIR doesn't know, you know, the extra immunocompromise that people might have or other things going on. So yeah, it is good to work it out yourself, but definitely a good starting point because that old data needs to be put into AIR anyway. So yeah. Another question, I've had some patients ask for men ACWY privately when they have had Bexsero. Is it recommended before 12 months?
There is a recommendation there that if the parents want to pay for it, then they can have it before they get it at 1 year of age. Where is it? Meningococcal. Hang on. So depending on how old the child is as to how many doses the child will need. So the younger it is, the more doses it will need. The child will need the one at 12 months, no matter what, because that's what they will need to see that the child is up to date for their vaccination courses. But if the parents want to cover the child for meningococcal ACWY, the Nimenrix can be given earlier from 6 weeks of age, and they would need 3 doses, 8 weeks between dose 1 and 2, and the third dose at 12 months. And then if they're between 6 and 11 months, 2 doses, 12 weeks, second dose at 12 months. Or 8 weeks after the first dose, whichever is later.
Yeah. So we've got 10 minutes left. Do you want to hop into the next schedule?
That's the
second one down, the other kid.
Yep.
Yeah. And keep asking questions as we go through as well.
Okay. So this is what's a good name for this girl?
Brooke.
Brooke. Okay, so this is Brooke. And the dates of assessment, her date of birth, the 19th of the 2nd, 2017. So she is 6 years now. Okay. So she hasn't had any, we've got no record, and the mother can't get any records. So we're going to vaccinate this child as if she's had none. which is a bit cruel. So in doing that, you've got to realise, looking at reactions to the vaccine. So as you start giving more of the DTP, you're going to find that some kids are going to really overreact, in which case you would need to make a medical decision as to whether that child needs to have more, depending on the reaction. Okay. So to make it easier, what I do, sorry. So what I do is look, as I said, I look at the catch up. I go to the HIB and the Prevnar. Oh, actually, this child is 6. So anyone over 5, they don't get HIB and they don't get Prevnar.
So Anne, I'll just share in the chat for everybody. There's a good table, number of vaccine doses the child should have received by their current age.
Oh, yeah.
Which is also another one that's helpful for these type of situations.
Are you going to put that up, or?
Well, you could, if you want to go to the chat, you can click on the link and then that bring it up because you can share.
Yeah. Hang on.
Click on the chat.
I've lost the chat.
So on the screen that you're sharing, the menu should come up down the bottom with the chat.
Yep. Yeah. So child age 6 to 12.
If you just make it big, it'll open up the table more. Make the window big. I'll go that way.
Yeah. Okay. So 4 years to 10 years, this child needs 5 unless the 4th dose was received over 3.5. Then the 5th dose is not needed. So this child's not going to need the 5th dose of the DTP. Hepatitis A isn't included. This child needs 3 doses of hepatitis B, 1 dose of the meningococcal ACWI, 2 doses of MMR, the pneumococcal, no. Polio, 4 doses, no catch-up for rotavirus, and 1 dose for the varicella, preferably 2. Okay, so the DTP, we would give none. Needs 3 doses. Dose 1 due now, and a further 2 doses. The same as this. None. 3 doses. 1 dose. 2 more doses, and I would give Infinrix IPV. For both those. No Hep, now the Hep A is not needed. The Hep B hasn't had any doses, needs 3 doses. Now the Hep B is here. Hep B is here. So the monovalent, the 3 doses of primary course, 2, 4 and 6 months, but yeah. So there needs to be 1 month between dose 1 and 2 and 2 months between dose 2 and 3, but there needs to be 4 months between dose 1 and 3. So I say, so that's 1. So 1 month between dose 1 and 2. And then 3 months to make it 4 months apart. 3 months between dose 3 and 4. No pneumococcal, hasn't had any of this, so they need one. MMR needs, they haven't had any, needs 2 doses. Dose 1. Now for this kid, I would give MMRV first, then MMR 1 month later. No rotavirus, they're too old, and the varicella needs 1, preferably 2. Encourage second dose. This child is not encouraged to have meningococcal because that's only under 2, and then when they're older. But they are encouraged to have flu. So influenza, 2 doses, 1 month apart. But they need to pay for it. And then the varicella, encourage second dose.
Yep. So, and just on that, we've got a question from Leanne. Why MMRV first if it is not recommended as first dose due to increased risk of temperature post-vaccine?
That's when they're really young. This child's older, so get the varicella in while you can.
Yeah, great. So at what age would you probably switch from going MMR first to MMRV first? Is there like a cutoff point?
Look, from 4 or 5 maybe, yeah, as long as they're well.
Yeah. Yep. Great. And then just on that as well, the dose 2 of varicella, which is recommended but not free, when is that recommended from?
A month. It would have to be a month after the first MMRV. So it can be a monovalent varicella given with the MMR. I know that's 2 injections, unless the parents want to pay for an MMRV, another one. That's another way around it, but I don't know how much MMRV costs. That's Priorix Tetra or Pro Quad. Or you can give it even a month after the second MMR.
Yep. So yeah, there's a few ways to go around it. And I've also put in the chat there a link to the NC's immunisation schedules. So that is this recommended vaccine schedules. And it shows on there which ones are free and which ones are recommended but not free, and at what ages, etc. So we have hit time now. So thank you so much, Anne, for your presentation and for showing how you do your work out your catch-up schedules. As homework for the group, there is 2 more catch-up schedules that you can work out in your own time. And if you'd like to, please register for a link that you'll get in an email post this webinar for a homework follow-up session on the 21st of March. So yeah, if you want to come with more questions or specific catch-up that you've got, from your work that you'd like to talk about as well, that's the space to do it. And will there be CPD log for us? Yes, this RSCGP is CPD logged, and I think, yeah, you get the certificate after attending, and you can log it that way.
Can I just say for the other 2, the date of birth for the 32-year-old healthcare worker is the 13th of the 5th, 1991. And the 25-year-old male asplenic is the 8th of the 2nd, 1998. Is that right?
Okay, and I'll include those again in the email that's post this webinar. So you'll have the date of birth for those to work out in your own time. And we hope to see you again on Tuesday, the 21st of March. Thank you, everybody.
Thank you. Bye.
Thanks. Bye.